Okay. Namaskara. Ahara Arogya Adhyatma. The light of Samskara. Welcome to that. Today we have a renowned gastroenterologist who has been head of the department in Saptagiri Medical College, and he is the director of Karnataka Gastro Center. And apart from that, he is the president of Indian Society of Gastroenterology. So a renowned gastroenterologist, Dr. Umesh Jalihal, is with us. Sir, welcome to our show. I would like to know, that is, July 28th is called as the World or International Hepatitis Day. Why the importance? Why they have chosen this July 28th for the celebration or observation? And I would like to know, people say the jaundice and it just comes and goes and drink, what to say, like sugarcane juice, and then you'll be all right. All sorts of myths are there in the mind. So I want you to clear the cobweb and give a real perspective about this hepatitis. What are the hepatitis? What is the incidence of hepatitis? Why it is a silent killer? What are the complications of hepatitis, and what treatment options are present today? All that I want you to explain to our audience. So please welcome Dr. Umesh Jalihar, and please go ahead, sir.
Okay. Thank you, madam. Thanks for having me on this eve of World Hepatitis Day. I think you have asked so many questions. I think these questions are there in the minds of several people in the community. I think that's the exact reason why we are observing or celebrating this World Hepatitis Day. World Hepatitis Day, we started in 2012 all over the world. It was started by the WHO, that is World Health Organization, in across many countries, 180 plus countries. Actually, it falls on the birth, the date of birth of the discoverer of hepatitis B is Bloomberg. So he was born on this day in 1967. Sorry, before that, but he discovered this virus in 1967. So then on, we have been having this hepatitis B and C related liver problems. So to bring awareness to commemorate this, his birth, date of birth, every year, 28th July is being celebrated as World Hepatitis Day. That's number one. Coming to the problems of hepatitis in the community is much. And World Hepatitis, WHO, that is World Health Organization, has given a declaration that we must eliminate hepatitis from the world by 2030. It is just, we are 5 years away from this, deadline of 2030, by which we have to eliminate hepatitis B and C, just like polio eradication program. So there was set a target to eradicate this menace of hepatitis B and C. So just to address this problem in the community, I thought I'll just take you through this short PowerPoint presentation. You can ask me the questions maybe after that, I think so.
Okay, sure, sir.
If you allow me,
Please go ahead, sir.
I will just take you through this PPT. So the global impact of hepatitis, if you look at especially the B, if you see it's a little old slide. The world population was 6 to 7 billion. At least 2 billion have had either past or present Hep B infection. And amongst them, 15 to 40% will develop the liver cirrhosis or HCC. And about 1 million every year die from hepatitis B. So if you look at the globe or the world is divided into 3 categories based on hepatitis B prevalence. If the hepatitis B is more than 8%, like you are seeing the countries marked in the red, it's high endemic areas wherein the hepatitis B prevalence It will be
Okay.
8%. That means if you test the 100 people, 8 people will have hepatitis B in their blood.
Okay.
And if you see the countries who are shown in yellow, the prevalence is something like 2 to 7%. That means it's
Okay.
intermediate group. I think
Okay.
India belongs to this category. And
Yes.
in certain Western countries, the prevalence is lesser than 2%. It's marked in green.
Okay.
So, this is how the hepatitis B prevalence is there across the world. And if you
Okay.
look at the disease burden in
Hmm.
the country, sorry, in the globe or the world,
Hmm.
hepatitis C, it's 300 million plus in 2022 are having hepatitis B and C, both B and C put together. 300
Okay.
million plus people are having the infections. And the tragedy is lesser
Hmm.
than 50% of the vaccines are given
Okay.
immediately after birth. There's a
Okay.
message from WHO that all the infants or the babies born of hepatitis B mothers or even otherwise have to be vaccinated, but only less than
Okay.
50% are covered. And
But in our country, it has been included in the national vaccine program, and as a result, along with the BCG, hepatitis is also started now. In
you are
the past,
correct.
it was not there. Now it
Yes.
is much better. Okay.
In 2007, it has come into the universal immunization program in
Yes.
India. But after
Yes.
that, the coverage is better, but still it's not 100%.
Okay.
So we need
Okay.
to be aware of this. And
Yes,
about
sir.
1.3 million die from Hep B and C in 2022. And
Okay.
if you look at the annual infections, about
Hmm.
2.2 millions are
Hmm.
having the new infections, and about
Okay.
6,000 new infections occur every day. And
Okay.
another important thing we have to keep in mind is that only 13% of people who are having Hep B C infections know that they have this particular infection in
Oh,
their body.
so
So
it
that's
goes
why we need to
undetected.
wait.
It goes
So
undetected.
it goes undetected. It's mostly asymptomatic. Many people
Hmm.
don't know that they have hepatitis B, C in their blood. So that's
Okay.
the tragedy of this whole
So this
scenario.
6,000 cases per day, is it in India or all over the world?
It's all over the world.
All over the world.
Yeah,
Okay.
I'll come to the Indian data. And
Hmm.
the another tragic story is only 3% get treatment. Only
Oh.
13% know that they have the infection, and only less than 3% get the treatment. Not all will get the treatment. That's the thing. And
Hmm.
if left unchecked, Hep B, C
Hmm.
put together can claim more lives than HIV, tuberculosis, and malaria.
Oh my God.
So, coming to the Indian burden, so
Hmm.
India is the local face of the global problem. In
Okay.
India, it's estimated that about 40 million people are
Hmm.
having chronic Hep B, hepatitis B, and about 6 to 12 million are having Hep C. And
Hmm.
Hep B alone, as I showed in the world map,
Hmm.
about 2 to 4% in India are having hepatitis B infection. That
Hmm.
means it falls into the intermediate category. So
Hmm.
5 out of 100 people, or little less than 5 out of 100 people will have hepatitis B. Randomly, if you check, people may not
Okay.
know that they have Hep B or Hep C infections.
Yes.
And vaccination, I was telling you about 2000, from 2007, it's come in the universal immunization program, and but still, it is far below than the expected. It's not the coverage is not 100%.
Hmm.
And as I said, there are so many, Hep B C infections in the world. Only 7 million 7 million Hep B patients get treatment. Only 12 million Hep C patients get treatment.
Okay.
So to understand this particular problem, I think that's why we need to know how are the symptoms so that the disease burden, the infections can be detected much earlier so that patient can get treatment well in advance or
Hmm.
at an earlier stage.
Okay.
So the symptoms, if you look at in the given patient may not have any symptoms. If you randomly just check, he may have Hep B C infection, it may be just detected only on testing. On a patient goes to some diagnostic center on pre-operative checkup, or is traveling overseas, or just randomly during antenatal checkup, the pregnant
Okay.
woman undergo this testing, it will be known. Otherwise, many times it will not be picked up. But in a patient gets what is called as acute hepatitis. That means
Yeah.
body reacts to this particular infection, hepatitis B or C. In a small percentage of patients, they may have symptoms like mild headache or mild fever, body ache, malaise, and vague ill health, and nausea, and aversion to food, and things like that. So that's what is called acute hepatitis, and they may have within a week or so jaundice, what is called as I'll show you in the next slides how the eyes look like. Yellow eyes and yellow urine or dark urine. So then some patients, it's called icteric hepatitis. But in some
Okay.
patients, it may not have much symptoms, and
Okay.
it will be passed off as some viral fever or some vague body pain, myalgia. And at a
Okay.
later stage, they will go into that chronic stage. At that point of time, they may have bleeding from the nose, they may have
Oh,
vomiting of the blood, they may have weight loss, fatigue, and jaundice. Okay,
okay.
like that. And in some patients, they may also have, I'll just show you in the next slide how a patient looks like. Swollen belly because of the
Okay.
water collection, because of the liver disease. You can see
Okay.
the in the diagram, the abdomen is distended because of the bad water that's collected in the peritoneum. Liver looks like this. Liver will be rough and shrunken and hard, as you can see this diagram. And this is the veins on the belly or the abdomen. And if you look at the eyes, eyes will look yellow, and the palms will be red, and you will find some kind of a Venus star, some kind of a spider nevi,
Spider
and
nevi.
spider nevi on the body in the trunk, abdomen, and the thorax area. And
Yeah.
you may have white nails, most important, white and flat nails, or sometimes the tip of the
Clubbing.
fingers will be bulbous, what is called as clubbing. And in advanced stages of the liver disease, we may find the hepatic encephalopathy, a condition called as hepatic encephalopathy, wherein we'll have, if you ask the patient to stretch his hands, he will have
Flapping.
flapping tremors, just like birds' wings. The
Yeah.
hands will flap. So
Yeah.
this is what is called hysterexis. This is a
Mm.
sign of advanced liver disease.
Mm.
And coming to the liver, I mean, this hepatitis B virus structure. This is the picture of the Bloomberg, who discoverer of hepatitis B, who got Nobel Prize for
Yes.
this important discovery in 1967.
Mm.
And this hepatitis B is 100 times more infectious than HIV, and
Okay.
it's about just about 41 or 42 nanometer in diameter. And
Mm.
this is the structure of hepatitis B. It has got an outer shell which is hard with
Mm.
spikes called as
Mm.
surface proteins or surface antigens. And it has
Okay.
got inner shell called as a
Oh.
nucleocapsid, and there are certain enzymes which will help it thrive in the blood, in the
Mm.
patient's blood. So once it enters the blood and it goes to the liver, these are the uninfected liver cells. That means the
Mm.
virus has not gone into the liver. Later on, it will
Okay.
go into the liver cells called
Mm.
hepatocytes, and it will cause liver swelling,
Mm.
inflammation, and it will cause liver damage. This is the
Mm.
normal liver, and you
Mm.
can see here how the advanced stage in the liver cirrhosis looks like. It's shrunken, and it's rough, and it's hard. So this is
Okay.
the microscopic appearance of the inside of the liver. You can see
Okay.
the initial stages of the liver swelling, and here you can see there will be a lot of bruises, and there will be variations in the liver ultrastructure.
Okay.
So coming to the transmission, it's very important to understand how the disease occurs, how these viruses get transmitted from one to other person. So, and
Mm.
if you know this, we can take a lot of preventive steps so that
Precautions.
precautions so that the disease doesn't occur in the community. So it's
Okay.
basically from the mother to child during birth. So this is the commonest mode, especially in high endemic areas, or it
Areas.
can happen from child to child transmission. Basically, the blood
Okay.
contact. It is just not
Okay.
like COVID virus by way of in
Droplet.
breathing or staying together. It doesn't come like that. It will be basically by way of blood contacts, needle piercing your blood, and the same needle pierces the other person. Then it gets transmitted from that person to the next person. So it can be child to child transmission or contaminated needles or through sexual contacts, especially in multiple sex workers with unsafe sex. It can get transmitted like that, or by way of transfusion of blood and blood products, especially
Okay.
infected blood and blood products can.
But now that has come down because before drawing the blood, all the tests are done and then automatically they are detected.
You are
So,
right, madam. But still, I think there are certain lapses sometimes can happen during the checking, and
okay.
there can be, especially if
Very
you are using the
dangerous.
card method, sometimes HbsAg can spuriously come as negative, and
Okay.
we may think that this blood is safe and it can get
Oh,
transmitted. And most
okay.
important thing in the medical setting, especially in the hospital setting, the if you are not sterilizing the equipments, we are doing it, but still there can be certain lapses. If
Okay.
the proper precautions are not taken, the sterilization may not be up to the mark, and then it can get transmitted from one person to another. Suppose
Okay.
hepatitis B patient comes and you conduct some delivery or surgery or dental
Hmm.
checkup, and next person comes uninfected, he is likely to get the infection from this infected needles
Okay.
or medical
Okay.
equipment. That's what you need to be aware of.
Hmm.
These are the common things. I think after having seen this transmission of hepatitis B and C, the immunity of the person also is very important. There
Hmm.
is three phases: immune tolerant phase, immune active phase, non-replicative phase. It all depends on the if you are very strong, if you have got a good resistance power, if immune power is good, and you
Hmm.
may not get the infection and it may not multiply. But
Okay.
if not, it can.
Okay.
So that's about how the infection spreads from one person to another, and who are susceptible for developing hepatitis B and C.
Okay.
Coming to the
Okay.
treatment, there are
Hmm.
many drugs available for the treatment of hepatitis B.
Okay.
Way back in 1992, we used to use interferon, and in 98,
But
we
that
started using.
interferon had so much of reactions and the people
Correct,
never
correct.
wanted to take it.
Yes, yes, and also
Okay.
the efficacy or the cure rates are not as
Not
good
high.
as the present drugs.
Yes.
So there's a lot of resistance, a lot of the side effects. So
Okay.
now we use what is called as entecavir, and we use tenofovir. Tenofovir alphanamide is a good drug. Both
Okay.
these drugs are now routinely used, and they keep the virus growth under check.
Okay.
Virus multiplication does not occur.
Multiplication. Multiplication.
Multiplication does not occur when you take these drugs, and these medicines have to be taken almost for many years or lifelong. That
Okay.
is the point all our patients have to keep in mind, that it's not like
Okay.
they take it for 1 month and stop it. That's about
Okay.
the medications. And who are eligible for this treatment. If
Hmm.
we do certain blood tests, like all the patients who are suspected to be having hepatitis B and C undergo liver function test,
Hmm. Hmm.
hepatitis B viral load, hepatitis C viral load, and genotyping, liver ultrasound scan, and various other tests. So when we do that hepatitis B viral load, if the viral load is more than 2000, and if the liver function test showing SGOT, SGPT, these are the enzymes called transaminases. If they are more
Okay.
than two times, we subject them for these drugs, or we
Okay.
put them on these medicines. So that is about the treatment and managing of patients with chronic hepatitis B. It's a summary. So what are the points we have to keep in mind? We have to identify this particular infection early, educate the patients, counsel who are at risk. Who are at risk? Most of the patients who are undergoing dialysis,
Hmm.
pregnant women, especially infants or babies who are going to be born to hepatitis B and C infected mothers, So they have to be careful. Healthcare workers who come in contact with this hepatitis B and C patients, and the spouses of infected, the patients or the persons who have the spouses who are having Hep B or Hep C infection. So we have to be
Okay.
careful with those patients. So you have to
Sure.
assess the risk factors, look at the burden of the disease, vaccinate, in time, lifestyle
Okay.
modifications once you know that there is a Hep B C infection, and
Okay.
prevent the transmission after having seen how it occurs. Screening
Okay.
is important. Regular health checkups have to be done. Assess and monitor chronic hepatitis B patients. In this, basically having diagnosed liver disease, do the
Okay.
clinical examination periodically, rule out liver cancer, that is hepatocellular carcinoma or cancer,
Okay.
and do regular liver function test and hepatitis B virus testing, liver biopsy in case you suspect some liver problem is there. Nowadays we have a good scanning called fibroscan. The liver biopsy is seldom done.
Hmm.
And screen family members. This is very important, and the close contacts, as I said in the
Okay.
previous slide.
Okay.
And
Okay.
if they are negative, vaccinate them. And if they unfortunately turned out to be positive, treat them like any other hepatitis B patients. Treat
Okay.
as appropriate and counsel. So these are the, I think this already I told regarding hepatitis B.
Drugs. Drugs are
Yeah,
there.
drugs. So these are the drugs I have shown in the diagram. Tenofovir alphanamide. Don't worry about the brand names. Entecavir for hepatitis B. And for hepatitis C, there's one drug called Velpanat or
Oh.
sofosbuvir velpatasvir combination. It is to be just this Hep C is
Hmm.
now curable or treatable, unlike
Okay.
hepatitis B. Hepatitis B is
Okay.
controllable. Hepatitis C is curable. If you take
Curable.
this tablet for 3 months, you are cured from hepatitis C. Don't have to worry about
Okay.
it. In
Okay.
case of hepatitis B, you have a opportunity to vaccinate and take universal precautions to prevent the transmission. But
Hmm.
God forbid, if you get Hep B, I think
Hmm.
you need to just take the medications like this
Lifelong.
tenofovir or entecavir for lifelong. So that's
Okay.
about. And this thing, hepatitis B vaccine is there for hepatitis B prevention. It is given as 10 units or 20 units, depending upon whether it's a child or adult. 1
Hmm.
ml, it's given in the just arm over the
Okay.
deltoid area, intramuscular, 0, 1, and 6 months. That means if you give
Okay.
the first dose now, second dose after 1 month, third
Hmm.
dose after 6 months. But
Okay.
sometimes, if there is a close contact who has got a Hep B positive, we give the third dose quickly as
Earlier.
3 months. So
Okay.
that's about that. So World Health Organization says how to protect or prevent hepatitis B and C. So
Hmm.
there are 6 actions they have charted out.
Hmm.
Use sterile injections, especially in the hospital setting. Don't
Hmm.
reuse the needles. We have not been using, but one of
Never.
the problems is with the IV drug users, drug
Yes.
peddlers, the
Drug
young
abusers.
people,
Yes.
the drug addicts. They use this needles
Needles.
reuse, and practice safe sex, and use your own razors and blades, especially who are having Hep B or Hep C infections. They
Yes.
have to carry their own instruments to the hair cutting salon, and so that it will not get transmitted from one person to another.
Yeah. Through
Otherwise,
the cuts.
our people are not willing to spend or pay more, and they go to some saloons and they reuse these instruments,
Blades.
blades, and certain sharp objects in the hair cutting salon. So they end up getting hepatitis B and C infections, sometimes
Yes.
even HIV, very rarely. So even when it comes to tattooing and piercing equipments, like children are the ear piercing and nose piercing
Yes.
happen.
Yes.
So they have to use sharp needles. They should not reuse them. That's a
Yes.
thing, so that
Very
they
important.
get infection from one person to another. Vaccinate infants against hepatitis B, and know your status. This is a very important step, I think the WHO is saying. See, many people, I don't have, I'm okay, I'm not normal. Why
Yeah.
should you test? Why should I undergo testing? So it's
Yeah.
become mandatory now. Most of the adults, whether they are at risk or not having a risk, they should undergo
Get.
regular hepatitis B testing and hepatitis
Okay.
C testing. This is what
Yes.
so all adults should be tested at least once for hepatitis B. Have you been tested? I will ask you, anyone who comes to me this question, so that they will be aware and they will get it tested. So
Okay.
the theme of 2025 by World Health Organization is
Let's
let's
break
break
it
it
down.
down. Let's
Yeah.
break it down. So what does it mean? See, whether it's a financial or social kind of barrier is there, we have to break it down so that we should not, we should not allow this hepatitis B to spread. So get tested early, get treated, get vaccinated, and break the stigma. Many
Okay.
people feel that the he has got hepatitis B, you don't go near him, and he's like that, and there is a
It's
taboo
not like that.
attached.
Yeah.
It is not like that. There is a stigma attached, and the patient is looked down upon by rest of their his colleague or her
Yeah.
colleagues. That should not happen. It's not.
It is
It's a
not like
medical issue.
leprosy or tuberculosis.
Correct.
It
Correct.
is a
It's not a medical
hepatitis.
issue.
Yeah.
It's
Yeah.
it's a medical issue. It's not a moral issue. So you
Okay.
should not worry too much about it.
Yes.
Have some kind of sympathy and empathy with that person who has got Hep B C infection. That's very
Okay.
important. I would like to tell all the people in the community.
Okay.
So, having said all this preventive measures and treatment, we'll come to the final.
So before you say the final words, I have two questions. One
Sure.
is you have hepatitis A, B, E, C, D, E, and
Yes.
also non-viral hepatitis like alcoholic hepatitis or other things.
Yes.
When you have so many more than six types, why have
Yes.
you taken importance to only B and C? That is one question. And the
Correct.
second, you are conducting a free hepatitis checkup camp.
Yes.
And what are the mottos and what are the things that you are going to do on that day? Please tell us, sir.
Yes, good questions. Regarding hepatitis, other hepatitis viruses, as you rightly said, there are at least five known viruses, typical viruses. They're called hepatitis A, hepatitis B, C, D, E. Hepatitis A and hepatitis E are the waterborne infections. Hepatitis
Okay.
B, C, D are bloodborne infections. That means,
Mm.
as I said, through blood contact, they get spread. Hepatitis A and hepatitis E are
Mm.
basically water and food infection related problems. So that there is and they both of them do not cause chronic
Any problem?
liver disease. That means you may get at the most one acute hepatitis. That means jaundice for a short time, and they'll go away. And most
Okay.
important thing, for hepatitis A, we have a vaccine. It's a preventable disease. And for
Okay.
hepatitis E, we don't have a effective vaccine. There is a research going on to bring out the hepatitis E vaccine,
Mm.
but most of them are self-limiting. They do not have much of problem. That's why I have left them out, and
Okay.
you don't have to worry too much about them. But of course,
Okay.
you have to take certain universal or preventive steps so that you may not get those virus infections. Coming to
Okay.
the World Hepatitis Day program in our center at Karnataka Gastro Center in Mahalakshmipuram, we annually conduct walkathon to raise awareness amongst the community people and healthcare workers. And we conduct free hepatitis B, C screening tests, blood
Mm.
tests, and
Mm.
it's all done free. Whoever comes, whether it's a healthcare worker or the any citizen, community
Okay.
people, we will not discriminate. Next
Okay.
is we also screen the liver patients. If you think that there is a liver problem,
Mm.
they needy patients will undergo ultrasound scan as well as fibro scan. And
Okay.
besides this, we do a lot of health education and counseling for the patients. And hepatitis B vaccine is given for free
Okay.
of cost. So
Yes,
that
excellent,
it
excellent, sir. This is, you are really doing an enormous service to the society. And thank you very much for your elaborate description and the preventive aspect and your walkathon. All the best to you, sir. Thank you very much.
Thank you, madam. Thank you.